people with ADHD make such phenomenal ED nurses, because think about it. When do people with ADHD do their best work? When they're under pressure, when everyone else is falling apart, right? Everyone else is losing their mind and they are in a panic. That's when the world, because there's so much chaos around us, the world slows down and we can have that just pinpoint focus and get everything done, where neurotypical people are just, they're lost in the chaos. But everything becomes the most clear to us under pressure.
Hello, and welcome to the Art of Emergency Nursing Podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here from the Art of Emergency Nursing, and thanks for downloading this episode, and thanks for listening to the podcast. I really appreciate it. Don't forget, as always, we want you to share this podcast episode with your friends, and share this podcast with your friends, because nurses like you are going to dig a podcast like this. Now, I want to remind you that I also have a second podcast. We started a second podcast with my friend, Dr. Lisa Wolf, and that podcast has a little bit more of a clinical focus. That podcast is called How Not to Kill Your Patient, and it focuses mainly on triage and patient assessment for rapid recognition of some of the things that might be going on with your patient. You are going to dig this podcast, I know for sure. So if you haven't heard it already, please download it, take a listen, and don't forget to leave a rating and review, because that's how other people like you are going to find that podcast as well. So my podcast today is actually a listener request. So a listener reached out to me via social media and asked if I ever thought about having a nurse on the podcast who has ADHD. And I was like, wow, that's a really great idea, because so many ER nurses probably fit that bill. And I knew just the person to reach out to. My guest today has her own podcast. Her podcast is called The Neurodivergent Nurse. Her name is Jami, and you are going to love her. She has a great podcast that's all about neurodivergence, mainly talking about ADHD in nursing. And I think you are going to dig this podcast. Now, I also want to tell you to follow her on Instagram, because her Instagram is fire. Oh my gosh. I don't know how many times I look at that thing and I think to myself, oh my God, this sounds just like me. So enjoy this episode with my friend, Jami.
Hi, I am Jami. I'm the host of The Neurodivergent Nurse. My podcast started in February of 2021. I had to stop and think what year it was now, since it's 2022. So I started that podcast then 2 months after I was diagnosed with ADHD at the age of 36. And I decided that while I was diving into everything ADHD, might as well make a podcast and take the other people along with it, so I could do the research, I could share my experience, and that they would have takeaways and tips and tricks to navigate through a neurotypical world with a neurodivergent brain.
That's awesome. That's what a really cool way to say, okay, like I need to know some stuff about this. Let's do some research.
Yeah, and it's been so much fun.
Now, you did a podcast before that. So, and then you decided to do this pivot and do this new podcast. And man, what a cool thing to be able to. Are there any other podcasts that are like kind of ADHD kind of focused?
Definitely. There are a lot that are ADHD focused. And I've taken a little bit away from some of them that I listen to. I don't really listen to a lot of those podcasts, but occasionally I'll have that thirst for it. I like a little bit more on the medicine side, the nursing side, some true crime side. But yeah, they have them, but some of them are really long. Some of them, they primarily have guests. And so I just took mine and I threw everything together. I just kind of made a big combination of every other podcast that I've heard about ADHD with my own little spin.
That's awesome.
Mm-hmm.
That's super cool. Now, one of my audience members was doing, one of my audience members who's a nurse that I'd known and worked with for a long time, sent me an email, and she's like, have you ever thought about doing something with about nurses with ADHD? Because think about how many nurses, ER nurses that you know that are either ADHD or ADD. What's the difference between those two? Like,
So ADD, there used to be a very distinct difference. And a few years back, they actually merged them into just being called ADHD. And so there's different types of ADHD, but now it's just all under the same umbrella.
I was going to say, I've always used those two terms kind of interchangeably.
Mm-hmm, yeah.
So she was like, she goes, I feel like a lot of ER nurses probably fit this bill. And I'm like, they probably do. Like I probably do. And then she's like, well, she's like, I'd like to learn a little bit more about it. And I was like, I know just the person to talk to.
Oh, I'm so excited.
I'd be interested to hear how you got your diagnosis. Like, what made you decide that you were going to go to the doc and be like, hey, what's going on in my head here? And then what did you do and how did that work out for you?
That's a really great question to ask. I didn't know much about ADHD growing up. I had the same idea that I think a lot of the general population has. If you hear the word ADD, ADHD, you think of that little boy that's about 8 years old that can't sit still in his desk, or he may be talkative or the jokester and drawing all the attention away from the teacher. And that was what I always thought with my naive, vision. I had a friend who very gently asked me if I had ever been tested for ADHD. And so, of course, I was like, no, I haven't. And she said, I really think that you should be. And she started sending me articles about how ADHD presents in women and in girls, and how it's so often missed. And a lot of people with ADHD, especially females, we have things like social anxiety. I had crippling social anxiety into my late 20s. I still had a lot of sensitivity when it came to rejection. I was always so worried about how everyone else perceived me. It's just a lot of little flags that were going up in her mind as we would talk about things. So I said, okay, sure. I went online. I researched a place here in North Carolina where I live, who they specialized in the brain when it comes to ADHD, any type of mental issues that people may have. And they made me fill out this very long questionnaire. And then there was also a questionnaire that someone close to me, which was my mom, had to fill out as well and answer questions about me. Send it back. And then they looked through it and said, okay, we're going to make an appointment with her. Went there. I had to do a drug screen. So I think that that's pretty common too. So if they end up prescribing you medication, they want to make sure you don't use cocaine as well, right? That could really cause your brain to explode or things like that. And then they took me and they sat me down in this room, and I was in front of this computer screen. They put something on my head. It was a sensor, and they gave me a little clicker in my hand. And on the screen with the instructions, I had to go through, there were two shapes, a square and a circle, and two colors, red and blue. And I had to click whenever the same shape with the same color appeared right after. So if it was a blue square, the blue square would go away, then another blue square I would have to click then. But if it was a blue square, go away, red square, I don't click. And for 20 minutes, I had to just sit there and stare at the screen and do it.
Oh, it's terrible.
Yeah. So what they ended up doing is they put how much I moved onto the quote unquote normal person and compared it. And of course, mine was a far outlier. I moved a lot more than the normal person. And also I was really good at it at the beginning. And then my response time started getting farther and farther apart. And so then I met with a psychiatrist, sat down with her. She went through everything. And that was how the diagnosis came about. So I was diagnosed that day, and she put me on Vyvanse, is the name of the medication that we started with. And I kid you not, the day that I took it, and my brain suddenly became more quiet. I remember thinking, is this how everybody else feels? It was so hard to believe that I wouldn't hear all of the thoughts all around me. I felt like prior to medication that I was standing in a money machine. Do you remember those money machines that you would stand in? It was big wind from the bottom and you would have dollars like circling. You're trying to grab them, shove them in your pocket. That's how I felt like my thoughts were, that they were just constantly flying all around me. And I was trying to just grab one to pull and hang on to.
Yeah.
And then, started taking the medication and the machine just kind of turned off so I could pick whatever dollar I wanted to off the ground. It was an incredible change. Yeah.
Like how that had to be just such a big difference. Like, you think about, I think about times when something has changed where just all of a sudden you're like going, oh, this is like, you had no idea this wasn't normal. Like you're like,
for 36 years.
Wow. Now,
it's a very long time.
You mentioned that ADD presents differently in women. How does it present differently? Like, how is it different from men to women?
So a lot of times young boys, right? Like I was just talking about, they're fidgeting in their seats and they are the class clown. Mm-hmm. Girls that have ADHD, they're often very chatty. And that's seen as kind of normal, but actually it's not. Or they may have a lot of trouble in school, though they're very, very bright. And it doesn't always match because normally someone who is very intelligent, they don't struggle with school. I remember for me, I was an A student, but it took me so much longer. I felt like everything that I wanted to be good at took me hours and days longer than just my other classmates to be just as good as them. Yeah. So those are just a couple. I did a whole podcast. The very first one that I did, the very first episode was about ADHD in females and why it's so often missed.
Nice. I'll have to take a listen to that, and I'll in the show notes. I'll put a link to the show notes to that episode so people can listen to it if they want to. I think it's I always joke when we used to do interviews for the ER where someone would be like, oh my gosh, they'd be like, I'm just so high strung, and I go this way to this way to this way, and I was like, oh, you're perfect for the ER because that's how we live, and that's fine as long as those thoughts and as long as that going from one thing to the next isn't intrusive to the point where you're not finishing what you need to do or you're not finishing your thoughts and that kind of thing. So it's one of those like that's okay as long as it's not okay, right?
Yeah, especially if you can recognize it, because there's a difference, I believe, with being flighty versus having ADHD. Some people, they just really are all over the place. They don't care, I think, is a lot of times why they can't circle back around to make a complete connection with what they started. And then they get distracted and do this, but ultimately it comes back. And even as a nurse though, I remember there would be times I had to learn to be a nurse a lot differently than everyone else. Especially when I was in the ICU, I struggled so much, especially neuro ICU, but I had to learn to write things down in a way on my report sheet, on my sheets that I would keep up with everything so that I wouldn't lose. Oh, I have to draw vancomycin at 2200 before I give the vanc, or else they could have toxicity if I make that error. Yeah. And then I wouldn't be able to forgive myself if someone lost a limb,
So at what point were you like, okay, like something's going on? Like, so did you start reading and then be like, oh, I get this? Or was it like, did you always suspect you maybe had something, maybe your brain wasn't quite wired like everybody else's?
No, I just thought, I don't know that I really knew that I was different. I was just very aware of my struggles, but it was the way that I always have been. So there wouldn't be that moment because it was just me. I'm just lazy. I'm just messy. I did realize and recognize that while I loved reading, it would take me probably 30 or 45 minutes before I would start retaining what I was reading. Yeah. That was just me, right? I'm not dyslexic. Yeah. So I knew I didn't have an issue with words getting wrapped around. It just wasn't sticking. And I thought it was just my makeup. I didn't realize that there was actually a disorder that went along with it.
Right.
The way that it was made, the chemical combination just made that difficult for me.
Yeah, that's interesting. That's really interesting that it, because you don't realize, because like what you sense, you're like, isn't this what everybody feels? Like, you just don't know. You're like,
and some people are really good at English. Some people are really good at math. Some people are really good at history. Some people are, they're marathon runners, while other people are great at, I don't know, playing football. So different people have strengths and weaknesses. And I think that caused me not to see myself as having a deficit in something.
Yeah.
I just saw that I was average, but I had the desire to not be average. So it just took more work for me.
Yeah.
And nursing school is especially difficult.
I got to tell you, like even, I considered myself, I was kind of a late student in nursing, and I considered myself a fairly decent student, but like everybody struggles in nursing school. It's hard.
I would read the questions and I couldn't comprehend. I was always bad at word problems and math. Yeah. That was difficult for me. And I felt like nursing school was nothing but word problems.
Yeah. Yeah.
And because you breeze over people with ADHD. When we read, we breeze over details of stuff. Right. And so I would bypass, not recognize that it would say not, or, what is the thing that you would not want to do? I would just read it as, what is the thing you would want to do?
Yeah.
It's terrible.
It's probably pretty easy to do. So that's cool. That's interesting. It's interesting to think like how different so many people are wired. Like you're just wired a little bit different. That's just all it is. I mean, it's just, now one of the things that I have found with, there's some nurses I've worked with that I'm like, oh, dude, you are like totally ADD or 100 miles an hour. And some jobs really reward that. Some jobs are like, good job. We're glad you're like that. We're glad you're built for this job. Go take care of here, go take care of here, be all over the place. But then some jobs are like, yeah, that's not going to work. Like, that's not going to be a great fit. Nursing seems like it, there's parts of it that can be okay as long as you can focus enough to get the quality that you need to get and the information that you need to get, then you're probably okay. But how do you think it compares for someone who just processes a little bit different? Maybe your process at a different speed.
I think
I don't know if
that's
that's the right way to put it, but
I understand what you're asking. I believe I understand what you're asking. For example, the very first ICU job that I got, the first hospital job that I got, I had to do 3 months as a floor nurse first before I got to move back to the ICU. I was crying every day about 5 o'clock as a floor nurse, 6 patients, having to juggle all of that. In my head, I could not keep up with all of that information. There was no tab in my mind that was helpful to remember all the small details. This person needs PRN pain medications. This person's blood pressure is 180. The fourth patient, that was not for me. It was a true struggle. I think that my ADHD brain could not retain that much. It's just like if somebody gives you instructions and they talk through about, let's just say 7 different instructions to do this one thing. I'm probably going to remember 1 or 2. If I don't write it down, I'm not going to be able to remember all of the things you want me to do. Now, moving to the ICU, I had 2 patients. And while they were very complex patients, I could remember my drugs to titrate things. Like, it was so specific and fine-tuned that was a lot easier to hang on to with my 2 patients. Gotcha. And now as a rapid response nurse, my attention is only on that one patient. I get a phone call, I run, I take care of that emergency, chart the things. It's just not pulled everywhere else. Yeah. And so the high-strung mind everywhere is great for those 2, whereas I think it would be so difficult to be a floor nurse and have that type of rapid brain.
Oh, yeah, that would be really tough. So,
or in like a doctor's office, like the energy that we bring is probably not suitable to be a nurse in a doctor's office.
Yeah, for sure. For sure. When you decided to seek treatment and say, hey, I think I got something going here, was there like an impetus for that you were like, okay, like I'm struggling, I'm having a hard time, not focusing, not, that you were like, okay, I got to go get this checked out? Or were you more like, okay, I'm reading about this and thinking that, okay, this might be a problem for me. Like what was the impetus for you saying, okay, I need to go see if this is like something?
Well, when my friend mentioned it and I thought, okay, well, I've done really well. I've been pretty successful in my career, in my life. When she first mentioned it, I was like, okay, yeah, I'll look into it because you came to me out of love. And as a friend whom I trust, I will do that. But as I started reading about all the changes that came with the diagnosis of ADHD, especially, I think medication, it's only effective for about 80% of people. For 20% of people with ADHD, it doesn't help them, which is really unfortunate. Yes, my heart breaks for those people. I'll send you that too, that you can put in the show notes in case any of the listeners want to read about that as well. Yeah. But as I started reading what all ADHD brains do and the troubles, to think that I could have help, because I didn't realize I'm not lazy. If I do have ADHD, that maybe it's more of my brain, not Jami as a person, because I love going to work. I would work 7 days a week if I could. I love it. Yeah. But when I get home, it is incredibly difficult. It's like you asking me to go out and run 50 miles. It's so hard for me to just get up and clean the house. Yeah. But I'm not a slob and I'm not lazy, but it's just a lack of executive dysfunction. Yeah. And seeing that those things could potentially change and be better was certainly a driver to seek a diagnosis, and not just a diagnosis, but maybe something that could help my brain to help rev me up to change some of my weaknesses in life.
Yeah. I mean, I love that you're like, okay, like, look, like things are okay. Things aren't bad, but they might be able to be better.
Mm-hmm. And they certainly have been.
Yeah.
Yeah.
How big a change was it when you actually went on meds?
Day and night. I did lose my keys one time recently, but I don't lose things all the time. I don't have a difficult time picking things up. I don't walk past the sock that's on the floor that's been there for 3 weeks. Or even my mom, she will say, I took classes this past semester, and one of the classes I didn't need. I actually called after I started the class and had a conversation with whoever answered the phone, whoever I had to go through. And they tried to convince me that I did need such class. And I said, no, actually, if this is the criteria, I don't fit that criteria. Yeah. And I got a refund on it and everything else. And my mom, I remember her saying, I'm so proud of you, because if you weren't on medications, you would have never made that phone call. You would have spent the whole 4 months going to that class, studying and doing the things that you didn't need to do. But now I'm not afraid to make phone calls. I'm not afraid that someone's thinking these negative things about me. It was just bizarre things that I thought prior to being on meds that helped out. Yeah. It's a completely different world.
Wow. That's kind of cool. And hopefully that gives some people who, maybe struggling with this a little bit, like kind of gives them some hope. Like, okay, things could get better. Like things, you're sitting there going, okay, things aren't bad. Okay, not bad's okay, but better's good. Like, like if you can make things better, why not make things better? So.
And I will say too, as I mentioned earlier, social anxiety was a thing that really plagued me, which is a common comorbidity for people with ADHD, because we're bullied a lot as children. And I think that also carries into our adulthood. I had social anxiety that was so bad in my 20s that I couldn't look in the mirror for weeks at a time. I would cry if I saw myself. I hated seeing myself. I would not get out of the car if no one was there to meet me. I would have a panic attack, and I was trapped inside of my own body where I physically could not make my arm move to open my car door.
Wow.
And that carried into being a nurse. And a lot of times I would think that I wasn't good enough. I wasn't the best. I wasn't whatever. And I would always feel like everyone saw me for what I perceived as imperfection, even though I did a job very well.
Yeah.
And it was difficult. But now, again, Vyvanse is, like I said, what I take. It also helps with my social anxiety. And now I have so much confidence whenever I talk to my coworkers. I don't worry that they're looking at me thinking that I'm not qualified.
Yeah.
The intrusive thoughts that were there that I thought that other people were thinking of me, it wasn't realistic. And I never recognized that.
Interesting.
Yeah.
That's really interesting. It's kind of funny because I can imagine, I've seen people who have diagnoses and then they start getting treatment and they get the right treatment. You're like going, like, this is like life-changing. I had no idea. They're like, I had no idea this was going on. And then I look at myself and go, oh, well, wow, this made a big difference.
You look back and you just think, spent all of those wasted years not loving and appreciating myself and not being proud of how far I came, or not being proud of all that I overcame and being wonderful at my job as a nurse. Yeah. Instead, I spent so much time concerned about what I didn't do enough of, instead of just enjoying flourishing in it.
Yeah, that's cool. It's cool. It's kind of funny how, like, just the suggestion of one person that says, "Hey, have you ever thought about this?" And you're like going, "Huh, no." And you're like, "Oh, yeah, maybe." It's kind of funny how that can be just life-changing.
Yeah, it definitely was. And then my poor mom, I'm her only child, and she was so sad for the first couple of months because she missed it. And I keep trying to tell her she didn't miss anything. Doctors miss it all the time in girls. And she's like, "But my baby, I knew that you were struggling with things, but I just thought that I was finding ways to make it easier on you," which she did. She was absolutely a wonderful parent, and she would know where my weaknesses were, and she would find ways to make those things a lot easier. Yeah. But she just felt like she missed so much in me not being diagnosed and getting the help earlier in life. But again, so many physicians miss it too, especially in females.
Yeah. Huh. That's really interesting. Why? I wonder why the gender disparity. Why is that? I guess just the signs and symptoms, right? A little bit more low key and not as intrusive, maybe.
Yeah. Well, the physical presentation is so different. Like I said, girls are a little bit more chatty, but girls are thought of to be chatty. And ADHD in general, you see boys that seem like they're bouncing off the walls and they're off the ceilings. And girls normally aren't the jokesters of a class. They typically aren't the ones that are drawing attention to themselves.
That's a good point. I never really thought about that, but you're right.
Yeah. Instead, they're the ones that are daydreaming. Those are a lot of times the girls that have ADHD. They're just off in another world. They can't have the attention held on them. Like I said, they struggle a lot with school, even though they're intelligent females. Or maybe they, instead of like bouncing off the walls, they have a really hard time sitting still. They may be fidgeting very low key, and it's not as obvious and prevalent.
Yeah. Yeah. Boy, I know. Sometimes I find myself do that. Sometimes I'll find myself just kind of like sitting and just kind of like, all right, kind of moving around, moving my seat, moving my hands. And you're like going, okay, like just stop. And part of it's like going, it's just, it just becomes so much of what you do. You're like, you don't even think about it. So
even the amount that you talk, my husband didn't pick up my medication the other day. And so I went one day without it. I can always tell a big difference. I don't take medication vacations like a lot of people do because I don't like who I am off of my medications. Yeah. I do really dumb things. I clocked out 3 times on the way out the door at 3 different clocks. No idea why.
Oh my gosh.
And I was so talkative to my colleague that was there multiple times that day. I told her, I said, "Catherine, I am so sorry. I am so chatty today and I can't pull it back. Like I knew it and I felt it and recognized it. And I still just had oral diarrhea the entire 12 hours. It had to be horrible for her. I felt so bad.
That's kind of funny. You're like, and you don't think of that as like an ADD kind of thing. Like, but I guess it would be. Like, I mean, it just, probably, 100 miles an hour, just talking about every little thought in your head.
And interrupting all the time.
Yeah.
Somebody will be telling you a story and then you interrupt because you want to tell them something else that you thought of before the thought leaves your mind.
Right. Mm-hmm. So many nurses I know, like that sounds like so many nurses I know.
Oh, really?
Yeah. Like a lot of ER nurses are kind of like that. And you just wonder, like, I wonder if you've ever been diagnosed. So it was, so, and what I don't know if I'll include this part in the podcast, but it's, about a year ago, I found myself at work and I just couldn't focus. Like, I was just like, I liked my job. I didn't feel burnt out. I didn't feel like I didn't want to be there, but I was just like I would get to work and I would do like a bunch of little nonsense things. And I couldn't like move the ball forward on things that really mattered. And I couldn't like dig in and be like, okay, I got to get started on this. I have this project. I'd be looking at this project board going, I don't even know where to start. And, you would get lost in the weeds. I don't know how many times I would be sitting there looking at a PowerPoint and be like, okay, spend an hour looking for the right font. And you're like, nobody cares.
Right? I still do that.
Just do what you got to do. Nobody cares. And I found myself doing all that. And then finally, I was talking to somebody and they go, do you have ADHD? And I was like, I always joked that I do. Like I've joked that I did and said that I did for ever. But never truly like really thought about it. Like never truly really like had a conversation with a doctor or anything like that. And they're like, look at the signs and symptoms. I think you would find that it fits pretty good. And I was like, huh. So I started looking at the signs and symptoms and I'm like, yeah, this is like totally me. Like this is like classic. And my wife was like, maybe some of this, maybe a little of that. And it got to the point where it worked. Like I was struggling at work. Like I just couldn't focus. Like I was just like, I was all over. I would be at work for 8 hours and be like, I didn't do I didn't accomplish anything. I didn't move the ball forward on anything. I did a lot of stuff, did a lot of talking, but didn't do a lot of like work. And so finally I was like, I'm going to go to the doctor and just talk to the doctor and see what the doctor says. And I got to talking to the doctor and I'm like, I don't know what it is, but like, I've never been diagnosed before, always joked that I had ADHD and never, it was always like, well, that's why you're an ER nurse, right? like that's perfect for you. And then, one day I was like going, yeah, like, but I'm kind of struggling. I feel like I can't focus. I feel like I can't concentrate. He's like, well, it sounds like maybe, and he was like totally open. He's like, I'm certainly open to giving you meds. Like, if you think you need meds, let's try it, see how it works, give it 30 days and just see. And I was just at the point where I was just frustrated enough that I was like, sure, yeah, let's try it. And got put on Adderall. And there's a little bit of a stigma to that. Yeah. There's a little bit of a stigma to that where, and I remember coming home and talking to my wife, and I remember telling my wife, I was talking to my doc, telling her I was kind of felt like I had a hard time focusing, felt like I was a little, I wasn't depressed. I wasn't anxious. I had a bout of anxiety where I had a couple of days where I was just like, oh my God, my heart's about to explode. Like, I don't know why I feel this sense of impending doom and I have no idea why. And, got some meds for that for like a minute, never took them, but got some meds for that. And then it was like, it just kind of went away. I was under a lot of stress at work and that probably was a big part of it. But when I went to the doctor and talked to my doctor about it, I remember my wife being like, you don't have ADHD. And I was like, based on what? And she's like, you just don't, like, you don't need meds. And I was like, and I realized like there was a little piece of her that was like, no, you don't need meds. And it was more kind of the stigma of the meds than anything else. And it was like, based on what? And she's like, I just don't think you do. Like, I don't think you need meds. Like, I think you're fine. And I was like, yeah, but I'm really kind of struggling at work. Like something's not, like my brain's not working right. And she's like, I think it's better than you think. And I was like, I don't think it is. And I noticed she had a little bit of a stigma with it where she was just like you're healthy, you're good. Like your brain's good. Like you don't need this. And then I started taking it and I was like, this helps. Like I'm a little bit more focused and a little bit more, I can focus a little bit better. I can, I noticed that I'm not as fidgety. I'm not as 100 miles an hour doing a million different things.
A little bit more patient.
A little bit more like, okay, we're good. And part of it too was going from the fast-paced ER world that it's like, your ADD, awesome. You're going to fit in just fine because we have another patient coming now. Go take care of that. And, but then when you get into like education or leadership, like there's not those kinds of fires. Like there's very few education emergencies.
Right.
Right. Like there's very few education emergencies where like, oh my God, this has to be taken care of right now. And when there is, I'm your guy. Like you're like, oh, we need to write this presentation today for tomorrow. Got you.
Yeah. Gotcha. Give me a deadline. It's a crunch. It can't be done. Let's see. We got this.
Yeah. We got this. I'll have you done tomorrow. My boss one day called and said, hey, you know what? We have somebody who's going to present. They can't present. Do you think you can throw something together on this topic? And I'm like, sure. Yeah, it's fine. Just, give me about 12 hours and we're good. And I showed up the next day to the class and she's like, well, so-and-so was sick. So Kevin's going to cover and covered and it went fantastic. And she was like she's like, you seriously did that last night? And I was like, yeah, I had to get it done.
Which is just another reason.
I've always, my whole life, I've, worked in the ER, like chaos. Great. Got this. It's fine. Like, you're sitting there and you look completely relaxed when you're, the world's just falling apart around you. And you're like, we got this sick kid, this sick kid, this sick kid. You're like, we're good. We're, they're taking care of this. We're taking care of that. I can take care of this. And you just don't even think about it. And I just remember like the pressure of, just stuff that like my wife was like, oh, there's no way I could deal with that. And I was just like, it's not that big a deal.
Or is satisfying.
Yeah.
Not that you want anyone to be sick, but it's satisfying in those moments because that's what you are good at, right? Yeah. You have all of this chaos all around you and you can literally put out every single fire one-handedly. And it's so nice to feel like you have that ability, especially when you look around and see that, in the ED, you have a lot of phenomenal nurses, but in general, those are situations that many people, they panic in and you're like, nah.
It's a struggle.
Yeah.
Yeah. And you're like, and most ER nurses are like, yeah, it's fine. We'll take care of it.
Right. And it's satisfying to just have that ability naturally too. It's not even a lot of effort was poured into being good at it. It's just, it comes so natural.
And rapid response has to be the perfect job for you.
Oh, it is the best job I have ever had. And I traveled for years and I loved it. And like I said, I love neuro ICU, and I don't want anyone to get upset if anyone listens to this part of the episode, but I don't have the same patient for 12 hours. And don't get me wrong, I absolutely loved my patients. I formed great relationships with the families, the patients themselves, and poured all of me into them. The neuro population is my favorite population of patients, but I don't have the same patient for 12 hours because sometimes some of the patients are actually really horrible. They are demanding. They have no respect of you. And you get verbally abused by them or by their family. I hated that. Guess what? I also don't have the same doctor for 12 hours. This may be Dr. A's patient. The other patient may be Dr. B's patient. So if Dr. A is in a horrible mood and Dr. A is just being a jerk to everyone, not my problem. And I don't have to fetch pain medicine. If I go to a rapid and there's not an emergency and they're asking for Dilaudid, I don't have access to the Pyxis. Sorry, I can't do those things. So it's great because I get to be who I want to be, pour all of me into this emergency or make a family member feel better. But then I don't have to be stuck with a horrible assignment of abusive patients for the entire shift. It's cool. Great. And you never know what's coming. The phone rings. Is it going to be a code blue? Is it going to be Mamaw slipped on a water and didn't really fall, but we just want you to come up here anyways? It's wonderful.
Sure. You're like, okay, I'll be right there.
Yeah. And the nurses treat you. And I was saying with the anxiety earlier, and you always want to be someone to someone. You want to be someone smart. You want appreciation, even though you're really not seeking appreciation, but you want to feel like you're doing a good job. Rapid response, when the nurses see you coming, they can breathe a little bit easier because you are their cavalry. Yep. And they always appreciate you showing up. They appreciate any advice that you have to give. Even if they make a phone call and they have a question, it's nice to be their resource and to have that appreciation for just doing your job. I feel that on a daily basis too. It's so wonderful.
I felt the same way when I was a house supervisor. I felt I was just putting out fires all day long. So
it's awesome. And on a good day, there's only two of us. So you have one person that you can really depend on, and the coworker that's there, you have a great relationship with, because you've had days, I'm sure, where you have strong staff, and then you have other days where your staff's not as strong, and you know who you can rely on and who you really need to lean on your own understanding. Yeah. But so this role too, we have very select people who are hired into it, who are all wonderful. And that also just makes it that much better.
That's awesome.
There's no competition. Wonderful. It's just pure feeding off of the other's intelligence and experience to have the best outcome for whatever we face.
That's really cool.
Mm-hmm.
That's really cool. So what do you recommend? So getting back to the kind of ADD piece and the neurodivergent piece, what do you recommend for people who think maybe they need to have this conversation with their doctor? How do you broach this conversation?
I tell people, which is not always common, and it depends on what country you live in, that I've come to find out. But if you live in the United States, I can give you advice on the United States and how to seek a diagnosis. I would highly recommend, number one, that you find someone who specializes in ADHD. Because if you really think about it, while your PCP may be wonderful, you would not want to go to your PCP if you were having a stroke.
Correct.
You would want to see a neurologist or a neurosurgeon. And a lot of times, again, they may be great, or they may have some stigma against ADHD, and they don't want to give you appropriate medication because they have some thought about it. So go to a person, seek that out. You want to make sure it's a psychiatrist, because a psychiatrist can prescribe medication, whereas a therapist cannot.
Yeah.
So when you're seeking that, that's the first thing that you want to do. You want to find someone who is qualified and someone who specializes in it, because I think that then you will get the most likely outcome to be properly diagnosed.
Yeah,
and be completely honest, because you're probably going to have imposter syndrome. I know I still do. Even when I go back every couple of months, I feel like they're going to think, oh, we figured her out. She was just wanting some medication for whatever reason. Or it's tough. You may have a little bit of guilt that's going along with, do I really have it? Or do they think that I'm faking something? But they know you feel that way too, if you do, because a lot of us do.
I'm curious how you handle, there's a little bit of a stigma to be neuroatypical.
Mm-hmm.
How do you handle that? How do you handle, you wear it like a badge of honor. You're like, it's me, baby. It's me, baby. I'm doing okay, doing good. I love your Instagram. I love your Instagram. I think your Instagram is fabulous. So much of that, I'm going, I got you. But where some people might feel a little might be a little hesitant to kind of own it the way you have.
Sure.
Like you've really just owned it and been like, here we go.
Yeah. Well, okay. So we have to rewind back to my last podcast that I did, First Do No Harm. It was all about bringing kindness out by making things normal. Like I had a trans man on there and he talked about his experience to try to help break that stigma and the ideas that people have because they aren't a trans man. They don't have a best friend or a spouse that is a trans man. So they don't know the life and the difficulties that they went through. And that was really the whole focus of my last podcast, was the things that people struggled with because of how society viewed them, right? And trying to break through those barriers. ADHD is not that different. There is a very large stigma around it. And I think it would have been more difficult for me if I didn't have so much support from my parents, especially my mom. But I struggled in nursing school. I struggled as a brand new nurse. I struggled in the ICU. And with all of those struggles, my mom would tell me, Jami, you're going through this right now, but you're going through it because you're strong enough to handle it. And your story is going to be able to help someone else go through the same thing that they may not be able to handle it. But by seeing you, they're going to know that they have the potential to make it through to the other side.
That's cool.
Yeah, so growing up feeling those things, I just don't really care. I mean, I care because I'm very sensitive to rejection. But then I know that a lot of people don't have the support that I have. And if I'm not loud about it, then they don't have a safe place. They don't have a place where they feel normal, where they feel accepted, where they feel that it is okay. Yeah. And the more you talk about things, the less shocking it is, right? So if I talk to a coworker, if I talk to a family member, if I talk to a stranger about having ADHD, then they kind of get baptized by fire. And so their first like, whoa, whoa, whoa type of feeling, it starts to break down. And then they're not as sensitive to those ideas when they can put a face, someone who is successful, someone who seems to have their shit together, which I don't. But fake it till you make it, really good at that. But, you know, a normal, quote, normal person to them struggles with this situation. And so the more that I wear it, the more that I'm a parent with it, the more of a safe space it provides for other people to just exist in who they are. And it's difficult being neurodivergent in a neurotypical world for so many reasons, and especially because of the stigma that's there. So that's probably why I'm pretty vocal and transparent about it. That's awesome. To try to kind of make it a better place.
I think that's super cool. And like I said, this whole conversation that we're having, one, I've been a fan of your podcast and I love your Instagram.
Thanks.
And a fan of you from your last podcast and even to this one and on to this one. But really what really kind of sparked me to want to have this conversation with you on the podcast was one of my listeners contacted me and said, hey, you know what? Like, have you ever thought about doing something on somebody who has ADD or ADHD? And I was like, funny you should ask. I know just the person to have. And I interviewed somebody before. I did a podcast interview with a woman named Maria. And Maria is very much a mental health advocate and very much a part of the conversation we have with the podcast, where she's like, oh, I was terrible ADD, like needed meds in the worst way. And she goes, and when I needed meds, like once I started taking them, like it changed my life. And I remember having that conversation with her, and I remember thinking to myself, okay, like putting this on the pod, and I asked her, I was like, can I include some of this stuff in the podcast? She's like, yeah. She's like, if it helps somebody out, awesome.
Mm-hmm.
Like, she's like, because she goes, there's kind of a stigma around it. And I got to thinking, I was like, there kind of is. Like, I remember being like, oh, you're on Adderall, you're on this, you're on that. You're like,
yeah,
oh, okay. But the same thing happens with almost any behavioral health med. Like, right? Like we expect healthcare workers who are getting their ass kicked and working hard and struggling and stressing. Yet I remember we were taking care of a doctor once, and this doctor was in our recess room in her hospital. And you got to think of what it takes to get you there to where you're like, oh, okay, I got to go let my friends take care of me. This is going to suck. But I remember when I talked to her and I was like, hey, I got to ask you about your meds and your history and stuff. And she's like, and kind of took a breath. And I was like, it's no judgment here. Just you and me, like just you and me talking, and like, you got nothing from me. Like, I adore you. I think you're wonderful. And let's just talk, like, just be honest with me with everything. And she was like, well, she goes, I'm on a couple of antidepressants. And I'm like, all right. She goes, I really struggle with depression. And I was like, never would have guessed that. So like you probably hide it well. So, okay, fine. Like no judgment, just kind of, sure. All right.
Which the stigma and the judgments and the stereotypes, they don't make sense to me, because if I am born with a hole in my heart, right, and I have to be on blood thinners because my heart is not completely perfect, would I be ashamed to be on a blood thinners?
Of course
Absolutely not. So if my brain isn't getting the uptake of dopamine because my neurotransmitter is just not working the way that everyone else's is, so there's a medication to help me with that.
Yeah,
why do I need to be ashamed to utilize that? If I broke my leg and I needed to use crutches to walk around, why would I be ashamed to use crutches?
Yeah.
I just don't understand the comparison there. The brain's an organ too, just like your heart, just like your gut, just like all the other things that we take meds for.
I remember having a conversation with a friend whose son is neuroatypical. He was diagnosed with schizophrenia at a young age, really young. And I remember his mom really struggling with that diagnosis. They're really struggling, saying, oh my gosh, like that can't be true. I'm not going to give him meds because that just can't be true. And I'm like,
well, that's terrifying.
Right. And I'm like, okay, think about this. I go, think about what you're saying here. I go, if he had diabetes, would you treat it? And she's like, well, yeah. I go, if he had heart disease, would you treat it? And she's like, well, yeah. And I go, he has a brain disease. Like, you got to treat it. Like, there's no question here. There's no maybe here. This is truly what your child's hearing voices that aren't there.
Right. And those voices could tell him to do something that could harm himself or other people or.
Exactly.
Yeah.
Exactly.
Why would you?
And,
Interesting fact, schizophrenia, so ADHD, we have a lack of dopamine, whereas schizophrenia has too much dopamine.
I did not know that.
Yeah.
I did not know that. And I just remember having that conversation with her going like he just needs meds. Like, it doesn't mean he's bad. Doesn't mean he's, broken. It's just, he needs meds. Like, he needs something to stabilize a chemical in his brain that right now is not stable. Mm-hmm. And I remember having that conversation going like, there's no judgment here. It just is. And she was like, oh, I guess I never really thought about that. And like, he's still like, he was diagnosed very young. Still takes meds, he does okay. He's not, he actually does okay. But he was struggling for a while and the meds really helped. So
that's awesome. And with that, those medications, a lot of times people who have schizophrenia, it's tough for them to take meds because then they feel like a zombie, and that's not how they want to feel. So maybe it was a good thing that he got started young, so he didn't have all of life experience to compare to feeling energetic and things like that.
Yeah. I think of like bipolar people when they're bipolar and they're manic and they're like, no, this is good. It's the best feeling ever. Like, I feel amazing. You're like going, you're a mess.
Yeah.
But they're like, no, like life's good. And you're like, so it's one of those where I could see where people would struggle. But there's that little bit of a stigma to it, and there shouldn't be. Like if you would, you had a broken leg, you'd fix it. If you had, broken lungs, you'd fix it.
And even for preventative things too, I mean, there should not be judgment. And I know that we always say as healthcare providers that we don't judge is what we tell people, but really we do have inherent biases against things, like whether those seeds were planted at a young age from our environment or the things that a certain population of people that we have interacted with who have kind of sealed a certain idea that we have had about each other, television, whatever. We all are individuals. We all go through hard times. We all are not perfect physically. We're not perfect socially. We're not perfect with any of those things. And it's so important to let people exist in their own way, in their own imperfections, or what's just perceived to be an imperfection that really may be, a superhero cape.
Yeah. I like that a lot. So this has been awesome. This has been a really great talk.
Thank you so much for having me on. I'm so honored that you invited me onto your podcast.
I'm so honored to have you on the podcast. I think your message and guys, I got to tell you, for those of you listening, like, follow her podcast, listen to her podcast. Her podcast is great. Your social media is incredible. I love your social media, and we get to talk about that a little bit. But I love your social media, and like so much of your social media, I'm like, oh, I get that. Like I can relate to that. Like, I'm with you. And I love your social media account. Like, I really do. I think your social media account's amazing. Love your podcast. And I'm so glad I got a chance to meet you. Like, we talked so many times before.
I know.
And then I got a chance to meet you at PodCon, which was awesome, and get to know you a little bit better. And gosh, boy, I'm honored to be able to call you a friend. And
likewise,
if there's anything I can ever do for you, please let me know. So.
Yeah, same. One last thing. If any of your listeners, I know that your podcast is Art of Emergency Medicine, but if any of your listeners, if they have ADHD or if they struggle with organization in the ICU setting, I'm going to email you a report sheet that helped me out to be able to go through and keep up with things with my ADHD brain that maybe you can send them if they reach out to you. Or if you, So I'm going to send that over to you probably tonight or in the morning. But anyway, so you'll have that available if anyone needs it. Any of your listeners want it.
That'd be very cool. Oh my gosh. Thank you so much.
Yeah, no problem.
The resource. And this has just been incredible. Like, I really appreciate you coming on here and taking the time to talk to me.
Thanks, Kevin.
So thank you. Hey everyone, Kevin here. I just wanted to give you a quick sample of what to expect on that other podcast I was telling you, how not to kill your patient. So here's a quick sample. Thanks again for listening. See ya. And I didn't take that approach. My approach was, hey, congratulations. You found your Achilles heel. You need to make sure to check your thought process every time you deal with an addict, because you have a blind spot, and now you know what your blind spot is, and now you can fix that. So congratulations for finding that. Do I agree with you? No, I don't agree with you. But good luck. But now you know that this is a challenge for you.
Right. Exactly. That's exactly it. Right. Like, you don't have to get rid of all of your baggage, but you need to know it's there.
Love that.
Need to know it's there, because otherwise you're going to trip over it.
Absolutely.
So I mean, the same kind of thing here is, along those lines, that blind spot, that's a really important to think about, because what we find is that the minute somebody says anxiety, or the minute you see Klonopin or Ativan or Xanax on somebody's med list, the tendency we find is that people assign all of a patient's symptoms to that psychiatric cause, right? So Dina Brescher and I did a review as part of one of our talks on patients with high heart rates. And we looked at the combination of anxiety and heart rate. And, if anxiety showed up anywhere in the reason for visit or whatever, and we found that heart rates as high as 130 were being ascribed to anxiety. So friends, kids, and campers, nobody has a heart rate of 130 just due to anxiety. Good. Just doesn't happen. Like, it's not a thing. So
keep looking, you're missing something.
Keep looking, right? Look for that sepsis, look for that, impending doom. But really, when we assign all of a patient's symptoms to a psychiatric cause without looking any further, you miss medical problems, right? Like, anxious people get sick too. Psychotic people have heart attacks. Like, these things it's not a binary. You don't have either psychological or medical problems. You have all of us have combinations of both of those things.
Absolutely right.
Right. And if you take the position like your, unfortunate Facebook poster, right? If you take the position that behavioral health presentations aren't worth your time, you're going to miss a lot of significant medical problems, and you're going to miss an opportunity to alleviate suffering in these patients.